13 things you've been doing wrong your whole life. Number 13. Going to the bathroom. Going to the bathroom is not something that we talk about in the open, but it is something we all do, and chances are most of us are doing it wrong. The sitting position when using the toilet is convenient and comfortable. However, it is not beneficial when it comes to getting your bowel moving. Sitting down when going number 2 means you have to push, which can cause tension and unnecessary strain to your body, resulting in pain and even hemorrhoids. The author of The Bloat Cure, Robin Chutkan, says we're designed to squat instead of sitting when using the bathroom. The squatting position allows us to press our knees against our abdominals, which produce pressure to excrete stool. Number 12. Charging your phone. The feeling of being low on battery is the worst thing ever, especially when you have to reply to messages, respond to emails, or take selfies. Using our apps always drains our phone battery, leading us to charge our phones on the go. While most of us leave our phones to charge for a long time, we're only supposed to charge in short bursts. According to Battery University, you shouldn't wait till you're at 1% to supercharge all the way back up to 100 because charging a lithium battery for long periods can wear it out. It is best not to charge overnight as well, and don't charge all the way to 100%, which risks stressing the battery. Number 11. Peeling a banana. Contrary to how we're taught, you've probably been peeling a banana wrong your whole life. I know what you're thinking, but why should it matter? Well, no one wants to eat a squashed banana. While we're taught to peel a banana starting from the stem, we're supposed to peel it from the bottom up. That's how monkeys do it, and you'd think after millions of years of evolution, we would know how to do the easiest thing. Plus, you're able to have a better grasp of the banana with the stem at the bottom. Think of it like a popsicle stick. Number 10. Sleeping. Ever woke up in the middle of the night and couldn't fall back asleep? Well, your body might be reverting to its natural sleep cycle. While getting 8 hours of sleep sounds like a good night's rest, our body is more inclined to rest in segments. This includes 3 to 5 hours of sleep, an hour of wakefulness, followed by another 3 to 5 hour sleep period. However, in this modern day and age, 8 hours of sleep is a precious commodity. Number 9. Eating cupcakes. I know, don't tell me how to eat a cupcake. But to fully enjoy your cupcake, there is a proper way to eat them. Apparently, the proper way to consume a cupcake also avoids getting any frosting on your nose and provides a frosting to cake quota in every bite. Just cut or twist off the bottom half of the cupcake and place it on top of the filling. Think of it like an Oreo cookie. This method allows you to eat your dessert in a mess-free and quick manner. Number 8. Washing your hands. Getting in there and scrubbing your hands with soap and water for at least 20 seconds is the standard way most of us were taught to wash our hands. However, experts at Glasgow Caledonian University in Scotland suggest this isn't the best method. There's a 6-step procedure to washing your hands. You start off by wetting your hands and applying soap. Rub your palms together until the soap is frothy. Proceed by rubbing each palm over the back of the opposite hand and rub between your fingers. Then scrub the back of your fingers against the other palm while interlocking your fingers. Clasp your left thumb in your right palm and scrub in a rotational way, then switch hands and repeat. Number 7. Using bobby pins. Bobby pins can either be a girl's best friend or a pesky tool because they can be frustrating to use. You can spend 30 minutes pinning up your hair for a special occasion only to have it fall out by the end of the night. Chances are you're probably not wearing bobby pins correctly. Everyone typically puts bobby pins with the ribbed part out, but you're supposed to have that ribbed part in. The ribbed part catches and secures even the smallest section of hair once you have it twisted in. Number 6. Brushing your teeth. Brush at least twice a day, floss, rinse, repeat. By now, most of us have mastered the technique of brushing our teeth with that same routine we usually do every morning and night. Dental experts suggest you should never rinse your mouth out after brushing your teeth, as doing so would wash out the concentrated fluoride in the remaining toothpaste, preventing it from working. While it's okay to spit out any excess, you should wait another time to use mouthwash. You should also not consume any food or drink for at least 30 minutes after using fluoride toothpaste. As hard as it is to imagine, the best time to floss is not after brushing your teeth, but before. Number 5. Giving birth. Majority of the women in the United States give birth in the lithotomy position, with the woman lying flat on her back with the legs up. This position makes it easier for doctors and nurses to assist. However, this isn't the best situation for the mother. This causes pressure on the seminal walls because the baby's head is uneven, and this labor procedure works against gravity. The World Health Organization advises giving expectant women a chance to move around during labor and alter their stance to what is most convenient. Side lying aids to slow the baby's descent descent. It does not use gravity, but it is still a better position to give birth, while the squatting position adds an increase of pressure in a woman's pelvic cavity. The birthing canal widens 20% more, and this is recommended for the second stage of childbirth. Number 4. Sitting. Sitting down for an extended period of time can increase heart disease, cancer, and it can even induce an early death. The human body isn't made for the right-angle back compress supported by the average office chair. Once you've become accustomed to sitting on a chair, your muscles relax and the entire weight of your torso is dependent upon your spine. The added stress on your spinal disc can contribute to chronic back pain, which leads to excessive slouching. Experts recommend active sitting is the best way to sit and to decrease joint pain and stiffness. While active sitting is a standard technique used for exercising, it's still an excellent way to get your blood flowing. Number 3. Applying deodorant. Applying antiperspirant may seem like a no-brainer. We usually use a stick of deodorant before heading out, but if you apply deodorant in the morning, then you are more likely to begin sweating before the antiperspirant has clogged your pores. According to The Verge, it is best to apply deodorant before going to bed, so it has enough time to inhibit your sweat glands. While your body sweats all the time, the rate at which you sweat during bedtime is the lowest. This is a critical factor because lower sweat rates form better, and efficient plugs reduce underarm sweat. It apparently also works even after you've taken a shower. Number 2. Showering. Bathing in hot water and lathering up in soap is the only way we know to get super clean. While we scrub our skin to get rid of dirt and bacteria, doing so can damage our body. The combination of washing, boiling water, and suds strip off the outermost layer of the epidermis, exposing our protective skin to elements and disease. Yes, antibacterial soap kills off microorganisms, but medical experts suggest not using these solvents on a daily basis, and showering doesn't kill off these organisms immediately, although it does move them around. A colony of bacteria inhabiting your bathroom wall might move to your arm and then relocate to your leg. Number 1. Breathing. Don't be surprised if you've been breathing wrong your whole life. Life didn't come with a manual to teach us the correct way to take in air. Most of us are regular chest breathers. If you inhale deeply right now, most likely your shoulders raised up a bit. With that technique, we only use a small form of respiration that uses the top part of the lungs. Not much lung power is being used because we're getting less oxygen and neglecting the bottom half, which results in us to breathe at a rapid pace than intended. The proper way to breathe is through abdominal breathing by inflating your stomach as you breathe in while keeping your chest stationary. Abdominal breathing gives you more oxygen per breath while strengthening your diaphragm.
Subscribe for more videos.